is the reality. Accurate, in-depth, and with the right perspective. For over 20 years, I have been a journalist, and never has clarity mattered more than now. At Newsnight, we go beyond the surface. We dissect the details, challenge the narratives, and bring you the unparalleled clarity you deserve in a world clouded by misinformation. We are bold, we are direct. Newsnight, for the news in your interest. Only on NDTV 24/7.
Is your business future ready? Join the 13-week strategic ESG certification program for business sustainability and growth for CXO and business leaders by NDTV, Terry and Zenora. Master global ESG frameworks, gain real-world tools, and lead with impact. Starts July 13th. Enroll now and power your business with sustainability.
Do you really know the company you invest in? What is the real picture behind presentations and claims? Is the outlook as rosy as the company claims? Know Your Company, powered by NDTV Profit Research, shines a light on the biggest stock market movers.
If it matters to you, if it matters to you, if it matters to you, it matters to India, it matters to India, it matters to India, and it matters to me, and it matters to me.
India Matters with Shivaru. Only on NDTV 24/7.
The markets move fast.
And so should your portfolio. Expert insights, real-time stock picks.
Do I buy Ola?
Should I hold CDSL for the long term?
Buy, sell or hold.
The answers you need, straight from the experts.
Callers from India and across.
It gives me immense pleasure to invite Srimati Anupriya Patel, Honorable Minister of State for Health and Family Welfare, to deliver the keynote address. Her steadfast focus on strengthening primary health care, empowering women and children, and driving inclusive health policies has been instrumental in furthering the vision of Swasth Bharat. We are honored to have her with us today to deliver the keynote address at the NDTV India Health Mission Summit. Ma'am, may I now request you to join the stage.
Namaskar. It gives me both pleasure and a sense of privilege to join you all for NDTV India Health Mission, a platform that brings together policymakers, healthcare experts, and change makers, all of us together, to think about the future of India's health. And by 2047, when India completes 100 years of its independence, it's time for us to ask ourselves, what should the health of the nation look like? And more importantly, how do we get there? Friends, as a government, when we look towards 2047, we envision the health of a country as a system which is resilient, which is inclusive, and which is technology-driven. so that it guarantees access to quality as well as affordable health care for all our citizens. Our government took over in the year 2014, and the first thing that we did was to come up with a new national health policy. And this new national health policy differs from its predecessor by focusing on a very comprehensive and integrated model of health, which encompasses preventive, promotive, curative, rehabilitative, and palliative aspects of healthcare. This policy has a much broader scope, and it makes a complete paradigm shift from the earlier policies that were in operation in the country. We are trying to strengthen primary, secondary, and tertiary healthcare in India. So when I say primary healthcare, 1,77,000 Ayushman Arogya Mandirs, which we have in different corners of the country and which have become the first point of contact for any ordinary citizen. We all know that there is a growing burden of non-communicable diseases in the country. And recognizing this burden, Ayushman Arogya Mandirs are today playing an extremely crucial role in their prevention, detection, treatment, and management. Why I say this is because every individual in the country who is aged 30 years and above is today being screened for diabetes, for hypertension, and for 3 types of common cancer: oral, breast, and cervix. And another noteworthy aspect of these Ayushman Arogya Mandirs is that it is providing counseling services for mental issues. Depression, anxiety, stress, all these are very common. Every second individual you meet has some of the other issues. And there is so much of stigma attached to mental disorders or mental issues that people do not want to seek medical help. So at such a grassroots level, Ayushman Arogya Mandirs are making that early intervention and also helping us to reduce the stigma that surrounds mental issues in this country even today. Ladies and gentlemen, the future of health in India is preventive. And we have that in our national health policy. But how do we take preventive health care to grassroots level? Here also the Ayushman Arogya Mandirs are playing a very important role. How? Because Ayushman Arogya Mandirs are today educating the community and creating awareness among the grassroots levels, community which resides at this level. And one of the key programs in the direction of preventive health in India is the Universal Immunization Program, which happens to be one of the largest in the world, where we vaccinate 2.6 crore newborns and 2.9 crore pregnant women every year. Government of India launched the UWIN portal to ensure that every vaccination session is being tracked and monitored, and no pregnant woman who's eligible, no eligible newborn is being left out. That is the way we are working. As I said before, we envision India in 2047 where every citizen has access to quality as well as affordable health care. And when I say affordable, the biggest initiative in this direction has been Pradhan Mantri Jan Arogya Yojana. This is one of the largest health assurance schemes in the world, which provides a 5 lakh rupee health cover to not just the bottom 40% population, but also 4.5 crore senior citizens, also 37 lakh frontline health workers, Asha Anganwadi, and now we've even decided to include 1 crore gig workers. So all I want to say is, this is a government in which health is no longer on the margins. Health is not a fringe issue anymore. Health is the priority of our government, and in 11 years of Modi government, health has returned to its rightful place as the cornerstone of nation's development and social equity. So let us all collectively march towards achieving universal health coverage and building a stronger and a healthier India by 2047. With this, I conclude my remarks, and I thank NDTV for giving me this opportunity to share Government of India's perspectives on health and what kind of India we want to see in 2047. Thank you all for being patient. Jai Hind.
Ma'am, do stay on. That was a very inspiring speech, and this is exactly what the NDTV India Health Mission also envisions. You talked about grassroots, you talked about the shared responsibility, and of course the media plays a big role in that. Now, as part of today's summit, NDTV is recognizing a select group of individuals and institutions who've made path-breaking contributions to healthcare in India.
Right, we would request our chief guest, Srimati Anupriya Patel, to please join us for the felicitations. Joining her will be Dr. Ashutosh Raghuvanshi, MD and CEO, Fortis Healthcare. Please. Known as the polio man of India, Dr. Matthew Verghese played a crucial role in the country's polio eradication efforts and runs the last dedicated polio ward at St. Stephen's Hospital, New Delhi. His lifelong commitment to public health has earned him global recognition, including praise from Bill Gates. It is our privilege to invite you to receive this honor for your extraordinary work in eradicating polio and transforming orthopedic care for the most underserved.
Dr. Dhananjay Divakar Sagdeo is being honored for his decades-long dedication to improving healthcare for tribal communities in Wayanad, Kerala. His selfless service reflects his belief that serving humanity is a form of divine service. Manav Seva is Madhav Seva. We're deeply honored to invite you, Doctor, to receive this special recognition for your pioneering work in tackling sickle cell anemia among the tribal populations of Wayanad.
Dr. Lalita and Reggie George founded the Tribal Health Initiative, which has changed healthcare for tribal communities in Tamil Nadu. For 30 years, they have transformed healthcare, maternal services, and health-related services in the Citilingi Valley. Dr. Reggie George, we are deeply honored to invite you to receive this special recognition for your extraordinary commitment to delivering healthcare to some of India's most underserved communities through the Tribal Health Initiative.
Launched in 2014, the Dettol Banega Swasth India campaign by Reckitt has reached 1 million schools across India and continues to generate massive impact in reducing absenteeism by 45%, increasing sanitation practice by 75%. Reckitt's impact is also seen in scaling up Dettol's Diarrhea Net Zero program, saving up to 100,000 lives of children under 5 years. These campaigns have been widely commended from the President of India and His Highness Dalai Lama, apart from global recognition. It's our honor to invite Ravi Bhatnagar, Director of Corporate Communications and Corporate Affairs, South Asia, MENAP, and Africa Reckitt, to receive this recognition on behalf of his company.
Dr. Shekhar C. Mande is being honored for championing India's rich scientific heritage and promoting indigenous innovations through science leadership. His work highlights ancient Indian contribution and inspires a vision of self-reliant Swadeshi science for a developed India by 2047. It is an absolute pleasure to invite Dr. Mande on stage.
Thank you so much, Dr. Raghuvanshi. Thank you so much, ma'am, for joining us on stage and sparing this time for this very, very important campaign.
I've been reporting on all issues big and small from Andhra Pradesh, Telangana, rest of South India, bringing you all the action, all that you need to know, all that you want to know.
The energy of maximum city is infectious. I'm bringing that energy in our news coverage from financial capital Mumbai.
Covering from the southernmost part of India over the last 23 years, I bring in-depth and 360-degree coverage from the Dravidian heartland.
The land of Mishti, also known for its bitter politics. I have seen much water flow under the Howrah Bridge, covering Bengal in all its vivid colors.
India's IT capital is always bustling, a city full of startups, stories and surprises. And I keep you ahead on all the Bengaluru buzz.
In today's interconnected world, India's voice is more crucial than ever. When India speaks, the world listens. At NDTV World, we are that voice, bringing you intelligent and insightful news, from India and beyond. From geopolitics and diplomacy to economic shifts, migrations, tech disruptions, and the stories of our diaspora. We cover the news that shapes our global future. NDTV World, your new home for global news, is here.
The last 1 month, if you see, the share prices of Denzol Engineering has fallen more than 58%.
Why are the rating firms calling the debt payments as default?
We have two credible credit rating agencies on March 4th coming and downgrading the stock to D.
Statements are consistently being proven wrong, and transactions are being taken place which are different from what they were originally pictured to be.
The company claimed it would roll out 6,400 electric vehicles. But what it has rolled out is a shocking scam. Funds meant for the project were funneled allegedly back to the promoters, the Junkie brothers. What did the money buy? Not EVs, of course, but a lavish flat in Gurgaon's luxurious DLF Carmelias.
If it matters to you, if it matters to you, if it matters to you.
As India moves towards the ambitious vision of Viksit Bharat 2047, one thing is clear. हर समुदाय तक सुलभ और समान स्वास्थ्य सेवाएं पहुंचाना हमारी सबसे बड़ी प्राथमिकताओं में से एक है. Bridging the rural-urban healthcare divide, breaking the stigma around mental health, and building strong primary healthcare systems. These are just not challenges, but opportunities to transform India's health landscape. इसी पर चर्चा करने के लिए हमारे साथ एक बेहद ही खास पैनल डॉक्टर सुनीला गर्ग, फॉर्मर डायरेक्टर प्रोफेसर कम्युनिटी मेडिसिन मौलाना आज़ाद मेडिकल कॉलेज एंड हॉस्पिटल, डॉक्टर धनंजय सागदेव, चीफ मेडिकल ऑफिसर स्वामी विवेकानंद मेडिकल मिशन, और डॉक्टर संजय राय, प्रोफेसर सेंटर फॉर कम्युनिटी मेडिसिन एम्स. आप सभी लोगों का बहुत बहुत स्वागत. अ वार्म वेलकम टू दिस प्लेटफॉर्म. डॉक्टर सागदेव, लेट मी स्टार्ट विथ यू. यू हैव बिन अ लिविंग एग्जाम्पल that community health care has to be one's priority. Tell us about your journey.
Thank you very much, NDTV. I am associated with NDTV's Banega Swasth India. So with this aim of NDTV, we are also working in Wayanad with Swami Vivekananda Medical Mission for last 50 years. I went there in 1980. You can imagine the situation of a tribal area 50 years ago. When I went there, absolutely there was no facilities for education, no health facilities, and basically Wayanad is a tribal area, and 80%, 20% of this population is living in deep forests. When I went there, actually we cannot go to the tribal villages also, and there was accessibility with them, and then no, they will not allow the foreigners or outsiders to come to their colonies. So all these challenges were there. So we had to find out ways and means to see that we get access to them. They feel that we are one among them. They have got trust, believe in us. So we gradually started visiting their tribal villages. Then we found out there so many problems are there. So gradually we found out what can be done.
Dr. Garg, Dr. Sagdev is leading by example. He took that initiative. But आपको लगता है जो हेल्थ केयर सर्विसेज हैं ग्रामीण और अर्बन क्षेत्रों के, उसका जो डिवाइड है, उसका जो डिफरेंस है, जो अंतर है, क्या वो कम हुआ है, वाकई नैरो हुआ है क्या ये डिवाइड?
I think thank you so much for a very important question. Like Dr. pointed out, I also have my foundation from rural area. Now coming to your question, that we have got now nearing, 1,60,000 Ayushman Arogya Mandirs which are functional. right? And they have come out of where? They've come out of sub-centers and also primary health centers, right? So, and we have got, basically not only, I'll say that there is presence of infrastructure with it, I'll say that we are 146 crore people. It's not easy. We are still coming up a big way. I will still say, but we have made a lot of progress in the direction of Viksit Bharat in terms of Ayushman Arogya Mandirs, that having, above them we have got, that means comprising of our sub-centers, primary health centers, and above that we have got community health centers.
Dr. Rai, talking about solutions, we are still living in India where clean drinking water is still not a guarantee. Basic sanitation is one of the challenges. So how do we fix these basic issues before we talk about community health centers reaching the people who are living far and wide?
I will start with first the gap between the
urban and the rural.
Urban and rural, and then definitely to the sanitation and other. See, no doubt this gap is narrowing down. But still, if you see any health indicator, either infant mortality rate, under 5 mortality rate, life expectancy at birth, all are lower, still lower in the rural area. But it's not only rural, urban. Even in urban, if you compare urban poor, there are some pockets in urban area. And if you compare these urban poor with the rural population, then all these indicators are worst in these populations. Urban poor.
Yeah.
So it's a 3-stage: urban poor, and rural. One of the main reason of this gap is accessibility is the main issue. If you see the doctor population ratio, it's more in the urban area. Then there are social determinants, social factors are responsible for this. Even in the urban area, we are facing problem. It's very difficult to tackle this problem. Somehow sanitation is not up to mark. So there are many issues, and all these are, it's not a medical issue. So these are the social issues. They are playing the important role. Even government is providing some basic facility, but many are not assessing that facility.
Dr. Sakdeo, क्योंकि आप उन इलाकों में काम करते हैं, इसलिए it's important for me to ask you that क्या हम आदिवासी और दूर दराज के इलाकों की स्वास्थ्य ज़रूरतों को एक देश एक समाधान से हल कर सकते हैं, और we need regional policies or specific policies area wise?
Yes, that is the main issue. जब हम पॉलिसी बनाते हैं, they are not visited the actually rural or tribal areas, what are the basic difficulties. So जब पॉलिसी बनाते हैं, तो जो sensitization of the health workers है and creation of health infrastructure with the special needs of the remote areas should be there. One is the Swasthya Mitra who looks after the tribal colony.
Right.
Next is, we have started this clinic on wheels and with telemedicine. So it takes health professionals, and then if for specialty care, the telemedicine unit works with the health Swasthya Mitra with the specialist in our hospital. Third will be taking the patients to the hospital, because many times the tribals or so many rural areas, there is communication gap, transport problem. So ambulance care is most important. So all this should be the policy, holistic approach.
Dr. Garg, जो अच्छा कम्युनिटी हेल्थ का एक बेसिस है, जहाँ हमने बात की क्लीन ड्रिंकिंग वाटर की, वी स्पोक अबाउट सैनिटेशन, द अदर एस्पेक्ट इज न्यूट्रिशन. What do you see the nutrition programs? What are the challenges we are facing on that front?
Nutrition is the backbone of country's development. When we talk about malnutrition, we are not talking about only acute malnutrition. We talk on chronic malnutrition. We talk on acute and on chronic malnutrition. You know, the challenges are very big. Let me tell you that it is not so very easy that what we talk about, you know, the availability of food, we tell our Anganwadi workers to provide food and all.
Dr. Rai, private sector तो छोड़ दीजिए, public sector में सरकारी पहल में बहुत कुछ काम हो रहा है मानसिक स्वास्थ्य को लेकर. ऐसे में क्या ये डिवाइड आपको वाकई कम लग रहा है, और इसकी प्राथमिकताएं हैं क्या? कम्युनिटी हेल्थ सर्विस की जब हम बात करते हैं तो मेंटल हेल्थ उसमें कहाँ ठहरता है?
See, mental health is a really big issue even in this country. There are few indicators. There are few direct indicators, few indirect indicators. तो definitely mental health का issue है. Government उसके लिए कोशिश कर रही है, but उसके लिए जो है थोड़ा सा again social responsibility भी लेनी पड़े, community को participate करना पड़ेगा. So community participation is one of the important issue in all the national health programs.
Bilkul, and a lot needs to be done on that front too, right? The other aspect around community health services and its programs are women. You know, the basis of forming those policies and programs is around women. स्वास्थ्य सेवाओं तक महिलाओं की पहुंच में कौन-कौन सी चुनौतियां इस वक्त हैं, और जो अर्बन पुअर हैं और ग्रामीण इलाकों की महिलाएं हैं, उन तक पहुंचने में सेवाएं कितनी अभी तक समर्थ हो पाई?
Gender based issues, when we call it as gender based issues, it's a big challenge still. क्योंकि आज भी अगर हम बात करें तो भारत एक पुरुष प्रधान देश है. हमारे यहाँ अगर हम डिसीजन मेकिंग की बात करें, डिफरेंट स्टेट्स हैं हमारी, and they're very different in their decision making, whether it is related to health, whether it is related to food intake, whether it is related to their common illnesses. जैसे हम reproductive illnesses की बात करें, वो कहेंगे अस्पताल क्यों जाना, क्योंकि डिस्चार्ज एक बहुत कॉमन सिम्टम है. किसके लिए? इसके लिए एवरी वुमन हैज़ अ डिस्चार्ज, सो आई हैव अ डिस्चार्ज. व्हाट इज़ द बिग प्रॉब्लम? Because and they are not able to understand, so communities are also not able to understand, families are not able to understand.
We're coming towards the end of this discussion, and my question to all three of you, since you all are experts in this field, in the vision of Viksit Bharat 2047, since we are talking about solutions, क्या हो सकते हैं, समाधान क्या है community health service सब तक पहुँचे और हर एक इंसान तक पहुँचे जो कतार में आखिरी खड़ा है? Dr. Sagdev, we start with you.
When we say it is a Viksit Bharat 2047, it should be all inclusive. We should have comprehensive health policies so that it reaches everybody.
Dr. Roy, एक प्राथमिकता जो जरूरी है इस वक्त.
Strengthening primary healthcare system is the single most important factor for this Viksit Bharat.
So, what Dr. Sanjay pointed out, so comprehensive primary health care, in true spirit we should be implementing all the 12 task forces, and nobody talks about, palliative care. So with the increase in life expectancy, we need to see that. Right. So सबका साथ सबका विकास ये बहुत ज़रूरी है. Thank you.
सबका साथ सबका विकास तभी संभव है जब कम्युनिटी हेल्थ सर्विस सेंटर स्टेज ले. बहुत शुक्रिया आप सभी लोगों का. Thank you so much, and thank you for taking out time for this very important discussion throughout the day. Thank you.
Actress and reality show star Shefali Jariwala, best remembered for her iconic appearance in the Kanta Laga music video and her participation in Big Boss 13, has passed away at the age of 42. Her sudden demise has sent shockwaves through the television industry and left fans heartbroken. According to initial reports, Shefali suffered a sudden cardiac arrest late last night. She was then rushed to Bellevue Multi-Speciality Hospital in Mumbai by her husband, actor Parag Tyagi, and 3 others. Now, doctors had declared her brought dead. The exact cause of death is yet to be ascertained. The post-mortem is currently taking place. Her family is at Cooper Hospital, where the forensic team is at as well. My colleague Abira joins us from outside Cooper Hospital. Abira, take us to the latest, what you're hearing as far as the post-mortem is concerned.
Right now, we saw Shefali's husband walk into the hospital, Parag, and we also saw Hindustani Bhau. So Hindustani Bhau and Shefali had met during Big Boss, and since then she has been tying Rakhi to him. He said, "Beti thi meri," and he was crying when he entered the hospital, and he went inside to see her body. Right now, what we learned from the people inside, the officials inside, is the post-mortem has still not started. A lot of other family members have are also inside, including her sister and family, very close family, friends. So we have to still wait for the post-mortem to happen, to come to a conclusion what really caused her death. She rose to fame because as a Kata Laga girl, and in an interview she even said that she is extremely happy that she is known as the Kata Laga girl, and till the day she dies she would want to be known as that. So it is a very, very sad day, and she was only 42 years old. But yes, we know that she had a epilepsy problem. She was diagnosed with epilepsy when she was 15 years old, and she used to get seizures. She also was battling infertility, but they had